Hi, my name is Dr. Andrea Avalon, and today I'm going to be talking about my QI project in regards to early recognition of cognitive impairment in internal medicine resident outpatient clinic. I'd also like to thank Dr. Manzo and Dr. Modak for assistance with this project. Let's get started. Cognitive impairment is defined as trouble remembering, developing new learning, concentrating, and making decisions which affect daily living. It is estimated that by 2050, 13.5 million Americans will develop Alzheimer's dementia. Studies have shown that over 40% of the affected population goes unrecognized. As of 2018, the Medicare annual wellness visit required primary care physicians to assess for cognitive impairment and annual visits for patients over age 65 to improve the detection of cognitive impairment. Several studies have compared the use of MiniCog in relation to other CI assessment tools, and even though it is inferior to other modalities such as the mini mental examination or clock drawing test, this assessment can be a great screening tool. Our aim was to improve screening of cognitive impairment in a Medicare Advantage population using the MiniCog. We hypothesized that process changes would increase the screening for CI. We screened all eligible patients in one managed Medicare Advantage population over the age of 65 who presented to our resident continuity clinic for follow-up or to establish care. Using the PDSA method for improvement, the MiniCog was used to screen for CI between March through September 2020. In March 2020, the use of MiniCog was implemented and placed on a huddle tool, followed by the addition of an EPIC smart phrase for documentation in May, and lastly, the addition of cognitive impairment documentation in the rooming section of our EPIC system. Patients who screened positive on the MiniCog test were then referred for a more detailed evaluation. Our results show that prior to starting this project in March 2020, only 36% of the 204 managed Medicare patients had been screened for CI. The systematic screening for CI showed improvement in the number of screened patients who were seen from March through September 2020 from only 36% to 79%. And you can see that on the image below. The systematic screening of patients for CI can improve rates of screening in a resident clinic. By utilizing pre-visit chart checks done by medical assistants, communication via huddle tool, and a standardized documentation, we were able to screen a large portion of a Medicare Advantage population. Our rates of screening might have been better, but about 34 patients that were attributed to the clinic were never seen. Our next steps are to see if these improvements are sustainable and if we're able to detect early CI by annual screening. In conclusion, with more than 16 million people in the United States living with CI, it is crucial for primary care physicians to incorporate screening during routine patient visits. As a primary care workforce, internal medicine physicians play an important role in recognizing early signs of CI, and by establishing a standardized approach, they're able to overall improve screening rates of at-risk patients. Thank you so much for listening. My references are at the bottom of the screen.